the last session, I discussed about the embryology part of gastrointestinal system. In the ending of the session, I gave you some questions to solve. The answers for the questions are: the first answer is failure of lateral fold closure, and the second answer is duodenal atresia. Today, I am going to discuss about the basics of dermatology. Now, let us see about the skin layers. Skin has three layers: epidermis, dermis, and hypodermis. Hypodermis consists of subcutaneous fat. Now, let us see about epidermal layers. Come, let's get sunburned is a mnemonic. There are 5 layers of epidermis. First one is stratum corneum, second one is stratum lucidum, third one is stratum granulosum, fourth one is stratum spinosum, fifth one is stratum basalis. Now, let us see about epithelial cell junctions. There are 5 cell junctions: tight junctions, adherent junctions, desmosome, gap junctions, and hemidesmosome. What is integrins? Integrins are the membrane proteins that maintain the integrity of basolateral membrane by binding to collagen, laminin, and fibronectin in basement membrane. Now, let us see about epithelial cell junctions one by one. The first one is tight junction. Jonular occludens. It prevents paracellular movement of solutes composed of claudins and occludins. Adherens junction. Belt desmosome, jonular adherens. It forms belt connecting actin cytoskeleton of adjacent cells with cadherins, that is Ca2 plus dependent adhesion proteins. Loss of E cadherins promote metastasis. Desmosome. It is called as macular adherens and also spot desmosome. Structural support through intermediate filament interactions. Autoantibodies to desmoglein 1 and or 3 leads to pemphigus vulgaris. The fourth epithelial cell junction is gap junction. Channel proteins called connexons permit electrical and chemical communication between cells. The fifth epithelial cell junction is hemidesmosome. It connects keratin in basal cells to underlying basement membrane. Autoantibodies leads to bullous pemphigoid. Hemidesmosomes are down below. Now let us see about dermatologic macroscopic terms. The first one is macule. It is a flat lesion with well circumscribed change in skin color that is less than 1 cm. Example is freckle, epiphyllid, and labial macule. The second one is patch. Here, when the macule is greater than 1 cm, that is, it is a flat lesion with well circumscribed change in skin color greater than 1 cm. Example is large birthmark, congenital nevus. Third one is papule, and it is elevated solid skin lesion less than 1 cm. Example is mole, nevus, and acne. Plaque. Papule which is greater than 1 cm, that is elevated solid skin lesion which is greater than 1 cm is called as plaque, and example is psoriasis. Fifth one is vesicle. Small fluid containing blister less than 1 cm is characteristic feature of vesicle. Example is chickenpox, varicella, and shingles, zoster. Sixth one is bulla. Large fluid containing blister greater than 1 cm is called as bulla. Example is bullous pemphigoid. Seventh one is pustule. Vesicle containing pus is the characteristic feature of pustule. Example is pustular psoriasis. Wheal. Transient smooth papule or plaque. Example is hive. Ninth one is scale. Flaking of the stratum corneum is the characteristic feature of scale. Example is eczema, psoriasis, and SCC. 10th one is crest. It is characterized by a dry exudate. Example is impetigo. Now, let us see about dermatological macroscopic terms. First one is Hyperkeratosis. It is characterized of increased thickness of stratum corneum. Example is psoriasis and callusis. Second one is parakeratosis. It is characterized of retention of nuclei on stratum corneum. Example is psoriasis and actinic keratosis. Third one is hypergranulosis. Increased thickness of stratum granulosum. Example is lichen planus. The next one is spongiosis. It is characterized of epidermal accumulation of edematous fluid in intercellular spaces. Example is edematous dermatitis. Fifth one is acantholysis. It is characterized of separation of epidermal cells. Example is pemphigus vulgaris. Sixth one is acanthosis. It is characterized of epidermal hyperplasia where there is increase in spinosum. Example is acanthosis nigricans and psoriasis. Now let us see the questions to solve. In which epithelial cell junction cadherins are present? Options are A. desmosome, B. zonula occludens, C. zonula adherens, D. macula adherens. In which characteristic type of lesion hives is seen? Option A is scale, option B wheel, option C macule, option D papule. The answers for the questions will be seen in the upcoming video. Thanks for watching. Do subscribe and support the channel. Thank you.